Dane County is about to greatly expand drug addiction awareness. It's likely a bigger deal than you think. We'll introduce you to the Parent Addiction Network of Dane County this morning on For the Record. Good morning, I'm Neil Heinen. Like mental illness or domestic abuse, drug addiction is a reality of life that many would prefer kept out of sight. The problem is that in most cases of all three, that's the worst possible response. We're beginning to understand that silence about these issues not only does no good, it can add to the difficulty victims and patients, people with problems and their families are facing, and complicate our understanding of the resources available or unavailable for people who need them. Thanks in large part to safe communities of Dane County and increasingly active public safety, judicial, and medical personnel, drug addiction, especially heroin, is getting a fresh look as are cutting-edge best practices for dealing with drugs, drug poisonings, and addiction. Here to talk about the soon-to-be-launched Parent Addiction Network of Dane County is Safe Communities Executive Director Cheryl Whitkey and Julie Foley, Crime Response Program Manager with the Dane County District Attorney's Office. Cheryl and Julie, thank you both very much for doing this.
Thank you.
Start, Cheryl, just by telling us, what is the Parent Addiction Network?
Well, this is something that came out of the summit that we held in January of 2012, where we found that there were a lot of resources available, but not a coordinated effort to look at all of the treatment resources available to families. And so when we broke into small groups at this conference, we had a whole group that was looking at how can we create a one-stop shop for families that are looking for ways to help their family members that are suffering from addiction. So that really came into a working group, and a lot of parents and law enforcement folks, judicial folks, treatment folks coming together and creating this network.
There was an interesting emphasis on heroin at the conference, and we'll talk about that, but this is broader than heroin, right?
That's right. Right, and you know, heroin tends to grab headlines, but if you really look at what's killing people or creating more addiction problems, it's broader than that. It's really the prescription opiates and prescription drugs in general. And as we've seen prescribing of opiates increase, we've seen an increase in both deaths from prescription overdose, prescription opiates, but also heroin. So there's a strong connection there.
Yeah. Julie, let's just engage you here by just talking about why this would be a place where the legal system, the judicial system, would want to get involved.
It's interesting. I think that sort of my entry to this whole issue was kind of by default. We go to initial appearance court. We're the trauma response component of victim services for the district attorney's office. And this issue kind of falls in this no man's land because oftentimes the individuals who are being charged are individuals who are addicted, who are committing crimes to sustain their addiction. It may be identity theft. It may be that they're taking a check from the middle of their parents' checkbook to try to turn it around for fast cash for drugs, pawning off family heirlooms. So our office is actually charging those individuals with crimes, but the individuals who are most desperate to try to navigate a system that is difficult are the ones that love those individuals and would do anything to try to assist them to challenge and beat this addiction. So we were meeting individuals in initial appearance court who were falling apart and saying, I don't know who to call. Their attorney is saying that they can't speak with me because they don't have a release. Other aspects of the court system were not readily available. Yeah. So we were saying somebody needs to help folks navigate this system. And this website that we're developing seemed like the natural connection to folks.
We're going to spend some time talking about that website. It launches on March 15th, so it's not up yet. But maybe we should just take a second, Julie. I listen to you, and I wonder how many people out there realize that victim advocacy is a part of the work of the DA's office. They might, I'm sure they just think of the DA's office as a prosecutorial office that is charging people with crimes, but a big part of the work involves work with victims.
In fact, you know, if we want justice in a society, the folks that are going to be asked to come in and testify about the victimization that they suffered and to actually mount a defense for or a viable prosecution and get justice for society. We rely on victims so heavily, and so I think that over time, and I think Dane County's done a really beautiful job, if we're going to ask victims to come in and testify about the worst experience of their life, we hope to engage with them at the earliest possible juncture and to provide them support and access and information so that they can feel safe and that they can feel like they have a true voice in the system.
I want to be a little careful about this because it can sound a little odd, but in the case of drug addiction in particular, it sounds as if the perpetrator can sometimes be the victim as well. Is that even fair to say?
Absolutely.
Okay.
So I do think that individuals who are addicted are often seriously, they're a victim of their addiction. And oftentimes the people that they victimize are the people that are closest to them. I don't think it's a conscious choice on many levels. I think that once you are having to sustain an addiction, especially of opiates and heroin, everything that I've heard is that the draw is so significant and so strong that they'll do anything to sustain the addiction. So it's oftentimes property that's most accessible or somebody that's closest to you that can provide the resources to be able to do that.
Cheryl, this is going to get into some of the resources that will be available on the website, but the conference a year ago was it's titled Drug Poisonings. And it wasn't heroin addiction, it wasn't drug addiction, it was the medical results of an overdose. And I think that's important for people to know because it gets into the relationship between prescription drugs and street drugs and how that starts to get a little murky. Explain, if you can, just kind of the current thinking about that relationship.
Right. I think that's really an important point, Neil. The sort of public health community, and if you look at CDC, Centers for Disease Control research on this issue, that's the term that they use is drug poisoning as opposed to overdose. And we find that the addiction, the folks that deal with addiction and recovery like that as well, because it lines up more with what addiction is, which is more of a chronic disease model than sort of the judgment that we tend to place on it. I mean, a lot of folks that have become addicted and are current heroin users started with legitimate use of pain medicines. I mean, I remember interviewing a young woman who was a student athlete who had a series of knee injuries and as a result was prescribed OxyContin, became addicted because that is a predisposition that she had, much as people are predisposed to diabetes or other chronic illnesses. Yep. She became addicted, could no longer obtain the prescription medicines through sort of legal channels, but her addiction was raging and she turned to heroin. And these are not uncommon stories. Right. I think as you look at this nationally and really the explosion of this issue. So it's a complex issue because we have to step away a bit from judgment, but we have to hold people accountable and we have to have consequences that yield results.
Yeah. There's a point at which this bumps into sort of a societal view of palliative care and pain management and the value of some of these really, really strong drugs. And you get physicians and pharmacists and people that have real different opinions on this. Right. Where is that conversation going?
Well, we have to be very careful not to restrict drugs to people who are dealing with end of life or terrible pain. And that's really not what this is about. We're working very closely with the healthcare community, and this is happening nationwide, to make sure that there's a balance there. And part of it too has come, sort of this, if you want to call it overprescribing, has come from a real interest on the part of the healthcare community to serve patients well, to make sure that they're not in pain. And maybe the pendulum, as some healthcare folks have described it, it's swung a little bit too far to being a little bit more permissive than we want to be. But keep in mind that healthcare providers are held accountable for their capacity to manage patient pain. That's one of the indicators that's used to evaluate them. So there are sort of structural policy things in place that need to be looked at, and I think education that needs to happen with healthcare providers and also with patients, that sometimes you're not going to have every bit of your pain eliminated.
Sure.
But let's manage your pain to the place where you can do what you want to do and be comfortable. We can't be entirely pain-free sometimes when we're dealing with chronic back pain or that sort of thing.
Well, when we come back, we're going to talk about resources, lack of resources, and we'll lead into a discussion of the soon-to-be launched website for the Parent Addiction Network right after this. I'm back with Cheryl Whitkey, the Executive Director of Safe Communities of Dane County, and Julie Foley, who is the Crime Response Program Manager at the Dane County District Attorney's Office. And we're talking about the Parent Addiction Network of Dane County, a relatively new group that is launching a website that will be available on March 15th. A website containing resources for people dealing with drug addiction in some way in their lives or with people close to them. It's interesting because the title Parent Addiction Network, I know there was a lot of thought about what to call this group, and you want to be clear, this is not necessarily just for parents, but it reflects a need, I guess, a real need for parents to be able to talk to each other, to have access to resources, to know that there's something out there, right?
I mean, that's something that came right to us after the summit, is just the number of parents that are just desperate to try to figure out how to help their kids deal with this addiction. And you know, and as you said, it's not just for parents, it's for anybody who cares about someone,
Right.
and they're looking for resources and they're looking for guidance. You know, it's that, I think, fine line between how do I support my child and how do I engage in the tough love that needs to happen.
Yeah.
And the stakes are very high. I mean, the stakes are life, death.
It's the Grandparent Addiction Network, it's the Friend Addiction Network.
Yes.
I mean, it's really for everybody, but
Right.
but parents played a really big role in pulling this together. And what's interesting to me about that is that it gets to this issue, Julie, of in many cases, just a real need for resources, a desire to access resources, and then feeling frustrated that you can't get them.
Mm-hmm.
Help us understand what's available and what's not.
Right, and it's identifying resources, but it's also navigating multiple systems that are very, very confusing in their own right. The criminal justice system is baffling to people, and I've had more parents say, the worst thing I thought I would ever do is to call and report my child to the police and to cooperate with the prosecution against my child. What we're finding, though, when you're talking about resources, Neil, is that sometimes in order for folks to avail themselves to available resources, it has to be through the criminal justice system. It's exorbitantly expensive to try to do this without support of the system. Insurance companies are really, really difficult to convince of the need for extensive inpatient treatment and long-term follow-up. And my experience is that in order to be successful, to beat this incredible addiction, which has not matched others in my experience, there needs to be a real village from the very beginning, from the law enforcement officer that responds in the field, to the prosecutor that's prosecuting this case, to the treatment facilities and the aftercare folks. And we all have to be teaming together to try to beat it.
But is there competition for resources with the prevention end of things to the treatment and response end?
And there's never, and I know Cheryl knows this even better than me, but there's never enough resources. But right now, it's a very, very tough fiscal time. And I think everybody is trying to make the best decisions with available resources. The issue that Cheryl just mentioned, which I am seeing every day, and as a parent can feel this very deeply, is this is a life or death issue. We have an amazing drug court in Dane County, but the waiting list sometimes is months long just because of the need. If you are an active opiate addict, you may not have 8 months, you may not have 6. And so as a community, I think to prioritize the safety of our most valuable resource, our children, our families. We've got to collaborate. We've got to identify what priorities are and figure out the best way to manage.
Does the network reflect that kind of dual interest in both prevention and treatment?
There's another kind of prevention arm to this, but that's really what we're striving to do, is to have all the pieces of it talking to each other. Because, you know, people are at different levels of risk. So you have to sort of take a different approach if somebody has a more elevated risk or is actively using opiates, as opposed to sort of the universal prevention messages that we want to do in schools.
Yeah.
And you have to be real careful about which message you're delivering to which audience. So we're trying to be thoughtful about that. But mostly we are really working to make sure that there's good communication happening across all these different entities.
Yeah.
Right.
I want to make sure we cover as many bases as possible. We talked about prescription drugs and pain treatment, which would suggest that this crosses all ages and socioeconomic status. But I want to be explicit about that if we can, that this isn't the heroin addiction stigma image that we tend to have. This can be what we would call successful professionals. Then you've got the young person who have access to these drugs in their home for some reason. In the medicine cabinet, the parents have or the grandparents have. This is a pretty complex issue.
It is, right. And I think the other thing to keep in mind is that it isn't just sort of a white middle class issue, that there's equally great impacts in communities of color. I mean, it's proportional to the population. So we have to also take a culturally sensitive approach to this and make sure that the treatment is reaching everybody that it needs to reach with appropriate treatment responses, I think.
Okay. When we come back, I want to talk just a minute or two about the drug court, and then we're going to talk about the website right after this. I'm back with Cheryl Whitkey from Safe Communities and Julie Foley from the Dane County District Attorney's Office talking about the Parent Addiction Network of Dane County. The website launches March 15th. The Facebook page is up now. Quickly, before we get to that, you mentioned the drug court, Julie, and I know that there's a pretty broad consensus of how successful that is. How successful is it?
Absolutely. I mean, as one parent put it, it's the difference between life and death for children because of the accountability piece, the checks and balances. I don't believe, my experience is that individuals who are going through this program want to succeed so desperately, but oftentimes they need that set of checks and balances, and also the commitment of the folks that are involved in seeing them through this process.
So we can identify someone as they enter into the system and direct them to the drug court so they get a different sort of approach to their, issue.
A broad-based set of checks and balances and accountability so that they are maintaining sobriety throughout, that they have a program, that they are accountable to a system, that in return, the difference between a conviction that may impact their ability to succeed in their life and the ability to go through a program and meet those challenges and be successful.
And the county executive's been pretty supportive.
Yes, I mean both the county executive and Mayor Soglin have supported this effort from the beginning, and in the Dane County executive's budget and with the county board support, they increased the number of slots for drug court.
Yep.
Yeah.
Cheryl, give us a preview of what will be on the website for the Parent Addiction Network.
Basically, it's designed to be a comprehensive look at, as Julie said, navigating all the different systems that parents have to navigate, including the criminal justice system. What happens if your child is arrested? How do you access help for that kid? The treatment providers in town and insurance numbers. How do you get a hold of your insurance provider to discuss this sort of thing? Commonly asked questions about, is my child addicted? What sort of signs should I be looking for? Paraphernalia, what does it look like? We're also linking to a lot of sites that already exist. So rather than reinvent the wheel, we're connecting to the National Institutes of Drug Abuse website and basically all the sort of evidence-based research that's out there, but it's very accessible. So we've looked for things that are accessible to parents.
And this is going to be disseminated by the partners in this effort, which again speaks to the importance of those partners, right?
Yeah. I don't think we can say enough about how this would not be happening if we didn't have just the broad-based involvement of an awful lot of people, from law enforcement, healthcare providers, treatment providers, the judicial community, parents. It's that's making this work. And and media, the fact that you're helping us get the word out about this is huge.
But this is a place where a nurse is going to be able to give somebody a card that says go to this. Someone who calls your office, Julie, you're going to be able to say,
Right.
and you will say, right, go to this network.
And the law enforcement officer, because there's such
Yeah,
a
good
push
point.
from the community
Good point.
deputies that are out in the rural parts of the county, that are in homes and that are dealing directly with families who are saying, I need some help, I need to figure out where to start. And so every question that a parent has asked to any one of our partners, we answer the question on the website. I mean, the beauty of this website is we have used the quandaries of parents when they hit a roadblock, and we have tried to figure out how we assisted them in navigating or how they navigated on their own, because parents have been remarkable in trying to figure out how do you get through this system and then commit it to a navigable website so that people in the middle of the night when they're feeling desperate can actually figure out how to call and tell the jail mental health people or the nurse their concerns about their child, and maybe expect nothing in return, but at least they can make that call and feel as though they're advocating for their child.
Yep, yep. The mention of law enforcement is so important. The idea that law enforcement now are looking for ways and availability to drugs that counteract heroin addictions right then. It's just such a life-saving approach to this rather than a criminal approach. It's a sort of a public health approach, and the balance seems to me what's so effective here.
It's phenomenal. We just had a meeting of law enforcement folks, people in recovery, and needle exchange folks to talk about how messages could be communicated across these different entities, and the commitment that folks are expressing and the gratitude really that the using community is showing. You know, at a time when there's been a huge divide, I think people are really starting to come together to see this as the public health issue that it is.
Yep. March 15th is when the website launches. You can go to the Facebook page now and find information. I think Channel 3000 is partnering as well as a place, so we'll direct you there as well. And thank you, Cheryl and Julie, very much for doing this today.
Thank you, Neil.
We're going to come back and wrap up For the Record right after this, which should just be me saying goodbye. So.
Okay, great. Thanks, Neil.
So here I said during that second break. My thanks to Cheryl and Julie for being here this morning. Next week, we'll talk to Mike McCabe, the executive director of the Wisconsin Democracy Campaign, about the uncertain future of his important nonpartisan watchdog group. That's next Sunday. We'll see you then.